Lyme disease is controversial. I'm Dr. Cameron. This is part of a Common Sense Lyme disease series. There's been an erosion of public trust. Public health has faced major challenges, emerging diseases, evolving science, and communication breakdowns. Lyme disease is not alone. There's mistrust that predates the pandemic. Patients feel dismissed, misunderstood, and abandoned. Now, when did medicine stop listening? Symptoms were disregarded if a test is negative. 30-day antibiotic limits were applied rigidly. Symptoms often attributed to some other disease like aging or stress. So one of the first problems was the testing issue. Lyme disease tests were calling for a 2-tier diagnostic criteria. This was intended for surveillance and not for diagnosis. That's where you need 2 out of 3 IgM bands, 5 out of 10 IgG bands, but it has limitations. There's false negatives, which are common in early infections. They're also common in late Lyme. This leads to delays in diagnosis and worsens outcomes. And then there's the controversy with regard to prevention of Lyme disease by taking a single dose of 200 milligrams of doxycycline. In other words, that's 2 100 milligram pills. Now, this protocol was only proven to prevent a rash following a tick bite, not Lyme carditis, neurologic Lyme, or other forms of chronic Lyme disease manifestations. Patients often develop late-stage symptoms despite early treatment in my practice. Another controversy, the 30-day treatment limit. The 30 days was based on narrow clinical trials of early Lyme disease. 30 days failed to address complex or chronic cases. Patients may improve with extended therapy in my experience. Another controversy, overlooking co-infections. Tick carry other infections like Babesia, Bartonella, and anaplasmosis. Many co-infections need different treatment. Doxycycline alone is not sufficient for all. In fact, for Babesia, doxycycline doesn't work at all, in my experience. You need Malarone or Zithromax or some other combination because it's a parasite. And then there's post-treatment Lyme disease syndrome. That is, PT stands for post-treatment, and it is Lyme disease treatment, but after 30 days, it's considered a syndrome by some. In the literature, a persistent infection is considered a possibility, but some doctors, in my experience, are reluctant to consider a persistent infection. They'd rather label it as a syndrome, in my experience. Persistent symptoms may reflect ongoing infections. Further treatment can help, in my experience, but guidelines resist it. So why does clinical judgment matter? Testing and protocols have limits. Individualized care leads to better outcome, in my experience. Treating the patient, not just the protocol, is my mantra. We need to rebuild trust. Chronic Lyme disease controversy reveals systemic gaps in public health. We need a roadmap forward. We need to listen, adapt, and evolve. Trust starts with believing the patient.